to, you need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. Welcome to the CareGiver Reality Show, hosted by gerontologist and family caregiver expert David Levy, speaking on a topic that is not only a national problem, but an international one, and represents one of the biggest dilemmas facing us today: Alzheimer's disease and dementia. With no cure in sight and hundreds more being diagnosed weekly, Alzheimer's is more feared than cancer or heart disease. Join us as David Levy breaks it down and educates, informs, and explains useful caregiver strategies and techniques that 25 years of non-clinical family caregiving have taught him. You can listen or call in and be part of the show. 888-565-1470 to ask your questions. And now, here's David Levy.
Good evening, Boca Raton, America and the world. This is David Levy coming to you from WWNN 1470 AM, right here, as I said, in Boca Raton, Florida, where it's been another brutally hot day. And you can catch us on CareGiverReality.com. Just click on Live Show and watch what we're talking about, which is an interesting combination. Have a lot of subjects to cover tonight, and might as well get started. First of all, I hope you all had a safe July 4th, and I saw the fireworks from New York that Usher choreographed. Was one of the most incredible productions that I have ever seen come out of the East River. But for those of you that saw it, you know what I'm talking about. For those of you that didn't, it was truly an unbelievable experience. Going to jump right into a bunch of subjects because we've got a lot to cover tonight. And the first thing I'm going to discuss is, you know, we have talked about all these drugs that have not made it to the marketplace, especially in the last 9 to 10 months. We saw Gamagard and Bapnuzumab and all those strange names that we know nothing about kind of go upside down because they didn't meet FDA regulation requirements. All right, that's not to say that they might not work, but they've all been focused at beta amyloid. All right, and that's that stuff in your brain that we see as plaques. And we're beginning to come to the thought that maybe beta amyloid is not the only thing that we should be talking about or aiming for. And I'm going to be discussing a couple of things tonight relative to that. But the first thing I need to tell you is, in my discussion with a couple of prominent neurologists and doing some investigating, one of the things that as a result of these drugs that haven't worked is that we have a tremendous shortage of dementia patients as volunteers to be in the drug programs. Now, these drug programs, for the most part, don't really put you at risk. They're not dangerous in the sense of some of the other drugs that get tested on humans to make sure that that they're safe. But if we do not have volunteers, all right, then we are not going to be able to do effective drug testing. And so when you see an ad, when you contact certain individuals that suggest that maybe you ought to be in a drug trial, please give you and your loved one should really give it some serious thought, because if we don't have folks that can test these things, we're not going to get anywhere except stay in the lab and have mice and other small animals that they test upon to be indicative of what is going on. But if we can't get them into humans, then we can't put it on the market. So please give it some serious thought. And also, for those of you boomers, all right, I'm talking about 65 and earlier, where I think the breakthroughs are going to come through is being able to diagnose a lot earlier and being able to treat a lot earlier. Now, I'm not saying that we're going to find a cure very soon or something to stop it, But I think the breakthroughs that are coming through with genetics and other kinds of approaches to drugs that have not heretofore been tried, that we have a pretty good chance of slowing it down. And if we can slow it down, then that means when it finally appears, maybe a good 10 or 15 years later than it normally would have. And that gives everybody an opportunity to have a quality of life and a better quality of life for everybody involved, just by being able to delay it. So please give some thought to being a volunteer. This week, we had some bad news, not on the Alzheimer's front, but for everybody. There's only 4 or 5 remaining long-term care insurance carriers. And many years ago, when I started my first company called Adult Care, I was owned by a long-term care insurance company, and we took care of all the caregivers when the insured went into claim. And that was back in the late 80s, early 90s. And at that particular point in time, what was going on in the marketplace was boomers were too young to buy life insurance, and most of the elderly decided that they really didn't need it if they didn't already own it. And the insurance companies didn't really have a product to sell, all right? And you're just like when you buy a house, there's an aha moment that you probably need fire insurance. And when you have a baby, that aha moment is, I better get some life insurance and protect my family. But there were no aha moments going on in the late 80s, early 90s. And so the insurance companies came out with a product called long-term care. And everybody jumped on the bandwagon. And so you had little companies, big companies, companies that just were formed for the purpose of creating long-term care insurance. And they sold like reasonably well. I don't think the market ever got much beyond 7% penetration. But here's the important thing to remember. What happened at the time is that all of the insurance companies were using the same kind of actuarial statistics, the same MetLife mortality tables. And the assumption was that you were going to retire from New York, come down to Florida, buy a condominium at Century Village, run over to Levitt's, get your Formica furniture, take 3 cruises, play golf, and the husband be dead at 72 and the wife would be gone by 76. And so they really didn't expect longevity. And if they did, the triggers for activating these policies was having dementia and a couple of activities of daily living, the ability to get around, cook, go to the bathroom, do the normal activities that are expected. So they figured with these triggers that there wouldn't be a lot of people coming forward to lay claim and that they'd make a good bit of money. Well, they were wrong. And at the same time they were looking at the mortality statistics, they didn't realize that the medical profession was in the beginning of helping us live longer. We had heart replacement, we had new antibiotics, we had inventions that prolonged our life, but they hadn't shown up in the statistics yet. And so what happened is the insurance companies got killed, all right? They were writing insurance policies for lifetime. They were writing them with cost of living adjustments. And when people went into claim, and we had the big jump in nursing home costs, they were paying out money hand over foot. Most of them went upside down, went bankrupt, and were put together by the various attorney generals and departments of insurance around the country in an operation whose acronym is SHIP, S-H-I-P, in Pennsylvania, where they still collect premium and very carefully pay out amongst all of these older policies. And hopefully there will be enough money, but it looks like those policies written for an extended period of time and never realizing the amount of dementia that was coming are going to sap whatever resources there are. And just this week, the big 4 that are still remaining in the market, it used to be the big 5, but MetLife got out of the business last year of selling new long-term care insurance. So that left Unum, Genworth, Hancock, and Prudential. And this past week, they all essentially announced that they were raising premiums on women 40 to 50%, and on men around 30, because men don't live as long as women do. And for those that were paying $4,000 or $5,000 a year for this premium, all of a sudden it looked like 6, 7, and 8. And there are a lot of people on fixed income that could not afford to do that. So what the insurance company did is they've started to negotiate with you. If you're willing to give up a lifetime benefit for 3 or 4 years, they'll readjust your premium. If you're willing to eliminate the cost of living adjustment that keeps pace with inflation, then they're willing to negotiate your premium. Without that, what they're really doing, and in my estimation, they are raising these premiums to force the rest of the people out of the business, to drop the policies, because they were based on very bad assumptions about longevity and the kinds of illnesses we would see in longevity. And dementia and living longer was the curse of the long-term care industry. And so I'm sure I have offended a couple of long-term care insurance agents, but I'm sorry. I've been in the business for a long, long time, and I saw a lot of this coming, and now it's come home to roost. So those of you that have policies, try and keep them as activated as you can. And if you got to negotiate, probably the best bet is to try and negotiate the cost of living if you're a little older, as opposed to the length of the benefit, because dementia patients are staying in nursing homes a good 4.5 to 5 years. So that's the first thing in the news. Second thing in the news is, and it's been raised a couple of times, but I don't think people realize what it truly means. When you get taken to the hospital, just because you're inside the hospital in the ER does not mean that you've been admitted. You're there, and in many cases, you're being observed. And for those who are 65 and older, this has a tremendous meaning. While you're under observation, some of the things that are being done, all right, are being paid for under your Medicare policy. But if you are not admitted, and many times you can be in that hospital for 24, 36, 48 hours, even put in a bed on the floor, but still considered to be under observation. And why are the hospitals starting to do this? For 2 reasons. Number one, if you're never admitted, then you can never be a bounce back within 30 days of being discharged and be a problem to them under the new Accountable Care Act. So if you stay in this pending status of observation, you never kick in, all right, the rebound effect. But more importantly, if you're not admitted to the hospital and you're in there at least 72 hours admitted, then you will not be able to trigger your rehabilitation and physical therapy benefit that follows most 72-hour stays. So if you broke your hip and you're in the hospital for 72 hours, you got to make darn sure that you can go to the nursing home and get the kind of PT and occupational therapy that you really need. Now, this is going to be a bigger and bigger problem. And when we come back from the break, I'm going to tell you the 5 things that you need to do to avoid this happening to you. All right. So this is David Levy. I'm on WWNN 1470 AM here in Boca Raton, Florida. You can call me at 888-565-1470 or go to the website caregiverreality.com, click on live show, and you can see us in true color.
Folks, when facing the decision to choose a nursing facility for yourself or a loved one, whether you're prepared for that or not, it can be one of today's most difficult decisions. When you, your spouse, or your parents need short-term rehabilitation after leaving a hospital or long-term care, choosing a facility for placement can be one of the most difficult choices you'll ever make. But it doesn't have to be. For such an important decision, what can help you the most is a provider that's always ready to give you the knowledge and trust you need to make informed choices with confidence and peace of mind. That's why you should call Hamlin Place of Boynton Beach at 582-3000. The friendly and professional staff at Hamlin Place are waiting now to help you make the best choice you can based on your loved one's individual needs. Just call 561-582-3000 and schedule a visit to Hamlin Place so you can learn about the many programs they have available. At Hamlin Place Nursing and Rehabilitation Center, they offer excellent courteous service and delicious nutritional meals in a clean, modern, and comfortable setting provided by their compassionate, caring staff of physicians, nurses, and therapists. Call Hamlin Place at 561-582-3000, where they can actively involve the family in the recovery process to restore the maximum level of independence in the shortest possible time. Call today, 561-582-3000, or come to Hamlin Place, where caring is our way of life. Hello, are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
Well, we're back, and you want to have a conversation with me, 888-565-1470. We're coming to you live from WWNN 1470 AM and on CareGiverReality.com. Click on Live Show. Before we went to the break, we were talking about hospitals and the difference between observation and being admitted. First of all, nobody should ever go to the hospital without having somebody with them, an advocate, a family member, because you're obviously in no position to ask questions and do things. So the first rule when you get to the hospital is ask, ask, ask. Ask whether or not you've been admitted. Look at the head nurse. Find out from her if you're being admitted. Ask in the ER, are you going to be admitted? If you can't find out, ask for and call for the patient advocate. Between all of those, you should be able to find out what your status is of observation versus admission. All right? If one of you, if your advocate is with you and they're holding your health care directive or durable power of attorney, ask to look at the chart and ask somebody to tell you, does it say on the chart that my loved one or the person that I'm here with has been admitted? If not, why not? And if not, when? Because you have to keep track of that. All right? You need 72 hours. And here's something else. It's 72 hours, not counting the day you are discharged. So if for some reason you're discharged at 11 o'clock at night, you lost 23 hours towards your 72. But if you make it to 12:01, then you caught the last 24 hours, and that may be the difference between a huge bill and the ability to get into a nursing home for rehab or a rehabilitation facility under Medicare. So this is something we all have to be aware of. It's going to happen more and more. One of the reasons that the hospitals are having to play so very, very carefully these days is something called RAC, and that's a recovery audit contractor. Now, that doesn't mean a lot to a lot of us listening, but it scares the heck out of the hospital. And what these are, and I saw one in operation a couple of weeks ago, these are major law firms that have some of the most sophisticated software that you can imagine for data mining. That means going into the records and seeing what really happened. And so what these RACs, or recovery audit contractors, are doing, they're getting a hold of the payer, whether that's Medicare, whether that's an insurance company, whoever is paying the bill. And they're saying, we will go through the people that you have paid on We will go through those records with this very sophisticated software. And if we find that there are errors, mistakes in billing, overuse, misuse, abuse, then we are going to collect for you monies that you did not have to pay out, and we'll split it with you 50-50. So the payer says, well, that's 50% back of money I thought I lost. And for these RAC, these contractors, it's a heck of a deal, because with software as sophisticated as it is, they can claw through that data and come up with stuff that nobody would have thought about. And let's face it, if you defrauded Medicare, there really isn't a statute of limitations on it. So you never know who's going to come through the door and claw back what had been successful payments to the hospitals and to the providers. So everybody has got to pay. Your doctor, the healthcare facilities, the hospitals, everybody is at risk because of these RAC, recovery audit contractors. You're going to be hearing more and more about them, because the insurance companies are going to take them on and let them go through those records and find that misuse and abuse that we all know happens, but is tough to dig out of the weeds. All right? I have to tell everybody, and I'm very proud, and it sounds like I'm gloating, but my Family Caregiver Practical Problem Solving Manual, which I took many years to write and put together, has just been awarded the Florida Council on Aging Gold Media Award for Best Media Publication for Seniors and Caregivers. So right now, I'm a happy camper. I got the letter this week, and on the 14th of August, I'll be in Orlando to accept my award, whatever that may be. But I'm terribly pleased, because I know how effective this manual is for helping caregivers. It's written in plain speak. It's written in a conversational style. There are plenty of places for you to take notes. There's an intake chart, which sounds a little formal, but it isn't really clinical, that if you were to fill out, would tell you where everything that you needed to know and what you need to know to be a more effective caregiver for your loved one. So if you'd like a copy, Family Caregiver Practical Problem Solving Manual, go on the website, caregiverreality.com, click it on, and you will see it available, and it's pretty reasonable. I think it's on there for $25 or $30. All right, I think we've got a phone call, and so go ahead, caller. I can't see who it is, but all right. You're on the air, caller. Go ahead.
My name is Chuck. I'm in Sunrise.
Okay. Hi, Chuck.
How you doing? Recently, I was in one of the hospital's emergency room, and on the discharge papers that I got, they said I had a well visit. Okay?
Yep.
And in reality, after that, I went to my doctor, and I've had a colonoscopy and other things done after that hospital, which they should have reacted while I was there. What do I do about this report I got?
Well, it's tough to fight against something, and I'm not a litigator in this particular area. But the first thing that I would do is I would contact, are you over 65? Was it Medicare?
Yes.
Okay, well, the first thing I would do, I would contact Medicare, and I would explain exactly what the circumstances were, that you went to the ER, you were suffering with certain clinical symptoms, that they elected to describe it as, it sounds like a well baby checkup, but they couldn't find anything. But yet when you went to your doctor the next day, it was pretty obvious, or within a few days, it was pretty obvious that you had a condition that required a colonoscopy, and I don't know what other conditions came about from that, but that's the first place to go to. And if you don't get satisfaction from Medicare, then the next place I would go, and if you truly feel that you've been given the short shrift on this, contact your local congressman, contact your state senator. All of them are very interested in hearing about this. They're the ones that set the budget. So go ahead, and that's the approach I would take, Chuck.
Okay, thank you very much.
You're more than welcome. Thank you for calling.
Bye-bye.
Have a good evening. All right, well, that's a perfect example. All right, he went in, he had his symptoms, but somehow or other, it just didn't work out the way he wanted it to. We're coming down to 2 minutes. Where did the half hour go? You know, Freddie said to me the other day, it's time for you to go and get an hour's show. And I thought he was kidding, but I don't realize how quickly the time went. And so I guess I'm just going to have to go ahead and take up a collection. And if you see me standing on the street corner with a piece of cardboard saying, I'll work for a half hour's time, that'll be me. But I'm terribly pleased that the show has really been catching on. We've had real good reaction to it. Caregiving is a subject that millions upon tens of millions of Americans and around the world are dealing with. And if you don't have the real skinny on what's going on, then you can't understand what your options are. You'll hear me say this over and over again. And if you don't understand your options, then how can you make effective decisions? Even if they're not the best decisions, you make the decision that you can at the time you have to do it with whatever you have to do. And from that comes peace of mind. Peace of mind that you did as well as you could at the time you had to do something. And nobody, not your sister in Peoria, not your kids in New York, nobody can accuse you of not doing right by the person that you're taking care of. And you'll hear me repeat this over and over again. Matter of fact, on the Huffington Post today, they made a great suggestion that next July 4th should be Caregiver Independence Day. And I think that's wonderful. And they wrote the first 10 clauses of what the Bill of Rights ought to be. And next week when I'm on, I'll read them to you. But I'm sure in the meantime, we're going to come up with a lot more things that you really need to know about to be an effective caregiver. This is David Levy. It's been a pleasure being on with you tonight. Thank you, Chuck, from Sunrise, WWW 1470 AM, CareGiverReality.com. And if you want a copy of that manual, just click on Shop, and there it'll be in all its glory. Thank you again, Boca, America, and the world. And this is David Levy, and I'll be back next Monday, and pretty soon I'll be back for an hour.
You have been listening and watching David Levy, gerontologist and non-clinical family caregiving expert. Visit our website at CareGiverReality.com and hear and see unscripted family caregiver support groups discussing all of the questions that you have wanted to ask but didn't know where to turn. Tune in again next time for more updates and special guests who bring their caregiving experience to you so that you can deal with your problems and hear how family caregiving is affecting fellow Americans just like you. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. Hello,